Scramble for beds is now on at the Mamelodi Hospital in Gauteng. Video clips have emerged showing women sleeping on the floor in an overcrowded ward. And that has been making the rounds, as you can imagine. Zikona Chona is monitoring the situation during the coronavirus outbreak. What did you find, Zikona?
So we received information from a relative of a patient at Mamelodi Hospital who had given birth and was moved to this overcrowded ward. Very concerned, the family saying that they do fear that she may contract the coronavirus. So we followed up and were able to speak to the patient themselves. And they said that they were moved after giving birth to her child. She was then moved to this ward, which at the hospital is referred to as Marikana. She says there are between 30 to 40 women in one room. There are only 4 beds in that ward. And there are mattresses on the floor, and you basically have to squeeze yourselves between each other, among each other, just to make sure that you can get a space to sleep. She says there are bags all over the place. In the bathroom, there were no sanitizers. We then followed up with the story and took it to the Gauteng Health Department, met with the MEC yesterday. For us, it was important that we validate the authenticity of our source. What was shocking for me was that the MEC first initial response to the story was, is this true? How do you know that this patient is indeed at Mamelodi Hospital? Instead of being shocked by the visuals he was seeing, he doubted whether they were true or not. And they also wanted us to reveal who our source was. And we couldn't do that because the patient was currently at the hospital, and they'd informed us that they were scared that they would be victimized if we were to reveal who they were. We couldn't give out their name as well as their patient number. Then we left the MEC, and he said we must rather communicate with the hospital CEO to try and see if we can get any further details. But here's the issue. Journalists don't speak to CEOs of hospitals. We communicate directly to the health department when we want to confirm anything that happens in any public health facility. Then later on, the CEO did confirm that the ward does indeed exist at the hospital. He says he wasn't aware. There was a matron that should have informed him of this, and they didn't convey this information to him. We then had to go back to the MEC to say, listen, you need to put a call to the CEO because he has now confirmed to ENCA that these visuals are indeed true. The CEO also did tell us that they managed to move the patients from that ward and find them better accommodation at the hospital. So we do know now, we can confirm, according to the health department as well as the CEO of the hospital, that the women have now been moved from that ward to a better ward in the hospital. So we asked MEC then to show us, where have the women been placed now? And his response was simply ask the person, basically go back to the whistleblower and ask her rather, to show you those visuals. Our priority in this matter was to protect our source, and we managed to do that successfully. We can confirm, and she has confirmed to us, that they did manage to be moved to a better ward at the hospital. We've been told that this ward at Mamelodi Hospital is referred to as Marikana. Women are crammed into one ward meant to be for maternity. Beds go to those who've been at the hospital the longest.
They call it Marikana because they can put plus minus 40 women in one room, and we sleep on it's only 4 beds. Then on the floor is mattresses, and then we have to squeeze ourselves. So
tell me, what are your biggest fears while you are there?
COVID-19, and my son is only 5 days. I'm breastfeeding her. What if I get infected in that room from those women? Then I go and breastfeed my child. When I breastfeed my child, I connect with my child. I kiss him, whereas I share. I don't prevent COVID-19 currently. I'm scared. I'm scared. I don't know what's going to happen to my child when we get out of here, or even myself, because I feel from here I need to go straight to the doctor to be checked with my child.
At Mamelodi Hospital. We showed this footage to Gauteng Health MEC Dr. Bandile Masuku. At first, he doubted the validity of our source.
And do you know the original person who sent it? And if it's false, what do you do?
The person is there. That's why I need to verify it. That's why I'm here.
Sharp.
Do you have his number, her number, and the patient number, so that you send it to? It's not that we are not going to, like, accuse her.
I can't share those details with MC because the person is still there and they're scared.
And what is she there for? Is she supposed
she
to be
gave
there?
birth.
Then she's supposed to go home.
Then why don't
stop
they
taking
discharge her?
videos.
You can't say she must stop taking videos.
Yeah, she must stop taking videos and she must just go home.
Later, after the MEC got an update from the hospital, he explained the overcrowding resulted from patients being diverted from Tshwane District Hospital to other health facilities, including Mamelodi Hospital.
They are shocking. It's one of those situations and instances that we don't want to see in our hospitals in Gauteng. But in this instance, it's an instance that it was a management lapse, and the CEO has actually apologized profusely to the mothers that were affected by this situation.
The MEC has assured ENCA that the situation has now changed. The MEC says the CEO told him he was not aware of the situation, but the question is, footage or not, how was this even allowed to happen? Zikhona Chona in Johannesburg.
Disgusting on so many levels that women have to go through this, and the fact that people in power are so defensive rather than their first response being that we will check this out, and it's up to us, the media, to prove something that they should already know. Zikhona, thanks for that.